Welcome to Wellbeing Matters in Salford, linking statutory health and care services to a supported voluntary, community and social enterprise sector.
Wellbeing Matters is a partnership of VCSE organisations led by Salford CVS, and it provides both the social prescribing pathways through link workers, which we call community connectors, but also supports the infrastructure that supports that social prescribing or the ecosystem of voluntary sector and community activities. We support anybody that's referred through primary care into Wellbeing Matters through a one-to-one person-centred conversation, which helps somebody find the right way to deal with their issue or problem, whether that be a physical or social or welfare need. So the link worker would have that conversation with the person and help them navigate through to the right level of support for them. We've helped to develop small and medium-sized voluntary sector and community groups through helping them to access volunteers, grant funding, support around their governance and constitution, but also to provide them with that level of support that they need just to take that step forward and accept referrals out of the community connectors or link workers.
Part of our role is building up brilliant relationships with other organisations, and when we first started the Wellbeing Matters programme, for 3 months we all went out and we did nothing but map what was available, and it wasn't just structures and physical assets in communities, it was meeting managers of services, and that could have been the voluntary sector, in the local authority sector.
We are supporting people through the pandemic.
So we're seeing various impacts. I mean, obviously a big one is social isolation, and you would expect that to be, more elderly people, but actually we're getting lots of referrals for younger members of society who are experiencing social isolation. Financial issues, obviously lots of people are, being made redundant at the moment, never claimed universal credit before.
We have learnt a lot over the past year.
The resilience of people and people's willingness to help others has really shone. And in terms of the voluntary groups who we support, obviously through this programme as well, because we work very closely with our voluntary sector, and without them we'd be nothing. If we didn't have things to refer people into, we'd be really stuck. And just seeing the level of how the voluntary sector stepped up to the mark, I want to see the service progress. I think the need and the demand for this service is clearly there. It was there before COVID, and I think the demand will still be there, and the need will be even more so. My hopes for the future is we've learned through COVID, we've learned how to help people become more resilient. We've learned how key it is to listen to people and make sure their voices are heard. And if we need to speak to secondary services, we're making sure we're carrying that person's voice forward with us.
We continue to make a difference to people's lives in whatever way they need. People are helping others, and the voluntary sector is proving essential, drawing on people power and peer support.
I think that it's accessible, and it's friendly, it's open, it's welcoming, and I think lack of accessibility is the major barrier to overcome. People just sometimes, they don't want to come and talk about their deepest, darkest problems. They might just want to come and have a laugh and have a chuckle with people. So, we supplement that with our social events, our WhatsApp groups, and, all these things are managed by people in the community. So everybody's helping each other out. And I think it's really nice to see.
We're seeing a reduction in people going back round the cycle, a revolving door of primary care. We're seeing people become more connected to their communities and getting more involved. So people typically come out of the programme, get involved with a community group and stay for the longer term. They're also helping to support the development of the groups themselves.
Greater Manchester is working together to better support our people and communities. We know that our lifestyles, where we live, our work, our money and the social connections we make most affect our health and well-being. That's why we are prescribing people local support and activities, improving health and well-being and the lives of our residents. Find out more at gmhsc.org.uk.